I remember growing up just looking around me at, my parents, their friends, and the friends and families that we had around us, and the struggles that everyone seemed to, face. And even at a young age, it just seemed like it wasn't right for people to be struggling, especially when it's an issue of access. And now I'm in a position where I can be that bridge and I can be that person to help with the language barriers, to help with the cultural barriers, and to really give families a chance and an opportunity to access and to navigate the system.
Each morning when I come in, I clock in, and depending on the day, some day we do have a huddle where we actually meet and catch up on cases or patients that we are working on that might be complicated, might be challenging, might need extra help, and we would have a huddle and talk as a team about it.
My daily routine would start with coming in, scrubbing the schedule, which means looking who's coming to see the provider today, looking what families we've already worked with, what new families we want to work with, and just really looking at that schedule and going back and communicating with not just the doctors but also their MAs that they work with, and being present for when they call us to go in the room, which is known for warm handoffs.
If I meet a family for a warm handoff, I'll set up, hey, can we set up an appointment to talk about this further? If they're like, sure, awesome, we set up an appointment. If not, typically we try to kind of keep contact over the phone until we're able to find a day that works.
One of us will just go over, sit down with the patient in the exam room, and just talk to them about like what next steps they have to take, where they need to go, what resources that they have to access. And we follow up with them to make sure that they actually get connected to the resources that we send them to.
Another big part is just like helping them organize their thoughts and organize what's going on in their lives, and just being like stability for them in a way.
Utilities is a big one that we work on too. Again, like food, cash assistance, and other like types of financial assistance.
So as family partners, we're able to share techniques and skills that parents can use with their own children throughout the week.
For families that have like a lot going on, all these pressing needs, whether mom lost her job or a child expelled from school, or there's things going on with housing, maybe they don't have food at home, getting their child engaged with therapy might not be their top priority, because life can be really chaotic for a lot of our families. So being able to bridge that gap towards almost the final step of the process ensures that a lot more of our families will get connected to the services they need, and kids will get the services they need before the situation becomes an emergency.
They know that you're not going to judge them. They know that your first reaction isn't going to be oh, let's take your child away. It's going to be like, let's figure out how we can get over this struggle that you're going through. As a doctor, you just have your 15 minutes and someone may spill something out and you don't know how to help them at the moment or don't have the resources to help them. Where I feel as a family partner, you have that time to listen. You are building relationships that allows you to say, if I don't have this answer right now, can I just call you?
Yeah, so we've had multiple doctors say probably multiple times that, they are lucky or more fortunate because they get to see, they see every kid coming in, but we mostly get called in for when things are going wrong, when people really need help, when things have become unstable. And so I think, whether the counselors or community health workers, that's just a weight we bear, and I think it can does lead back towards that like burnout question.
Because it's not a position where you can just come into work, punch in, do your thing, and then just leave without carrying anything with you. You're connecting with people. You're getting to know people. You're going to feel for them, and you're definitely going to carry the stories and the burden and the stress and concerns that they have with you.
There is plenty of times that we have sent clients to DTA to get, we know the need, we know that they need a shelter, and they still get denied, and that makes us feel horrible, right? Because we're trying to do the best that we can for our clients, but sometimes it's systematic. There's something that we cannot control. Adira mentioned like being able to speak to one another and also brainstorm of other ways of how can we possibly assist the families.
How do you do the work that you do and leave home not really kind of ruminating on every single thing that you've experienced at your job? I guess the shorter answer is kind of like, it's difficult. I think that one big thing that's kind of helped me kind of unload, I would say, is
just to have other people who understand to like help bear a little bit of that weight.
I think it's really important that we take break, take a time for ourselves, whether you take a quick walk, take time to just relax, take a day off just to recuperate, so that way we are not burning out.
This community has done a lot for me. And when I was growing up, I went to Tech Boston, which is right down the street, and Codman Square had medical and behavioral health on site. And they were part of my life. And now being able to give back and knowing that I can make a difference in families' lives is what I love most, is what keeps me coming back every day.
It's so important, the role that we have and what we do, that there really is no giving up on it. It's just figuring out what you need to do and coming back.
I'm able to get them connected to resources that address very simple things, but it has a great impact on their outlook on life.
There was a family who was truly in need. It was a young mom who has 4 children and had just had twins. And I actually just met with her not too long ago, and she finally has her own housing. One of the children who was having behavior problems in the school was really struggling to support him, has now gotten to BPS and will be starting in the fall. And he has an IUP and all the supports that he's gonna need. And the other children are doing really well as well. And mom has been connected to so many community resources outside of Codman Square that's truly supporting her, and she can now see that it's finally all coming together.
Oftentimes our work is with the parents, but that is, a nice little add-on when there's a cute child in the room.
Having a client that never smiles in like the past 3-6 months in every visit that you have, and then just by a simple approval of a DTA SNAP benefit, and the whole perspective of life have changed because they see hope. They see that they see the light at the end of the tunnel. It's amazing.
Yeah, being able to, be a safe person for families to go to count on,